Assalamu alaikum class. I hope you all are fine. Today we'll continue with the second lecture on maternal health. In the previous lecture we discussed about the antenatal care. Today we'll discuss about the intranatal care, which is the care given during delivery, and the postnatal care, which is the care given after the delivery. Now, coming to the intranatal care. Now, childbirth, as you all know, it's a normal physiological process, but complications can arise during that period, and most important complication is the septicemia. Now, infections or septicemia can result from septic manipulations and unskilled manipulation and tetanus neonatum from the use of unsterilized instruments. So the emphasis is on the cleanliness, which should be maintained during the delivery process. And by cleanliness, we mean that during delivery, the person who's doing the delivery should be properly equipped, and that person should have clean hands and finger nails if the delivery is done at home, and the delivery should be performed on a clean surface, and the clean cord care is very important. That is, you cut the cord with a clean sterilized blade, and before cutting the cord, the aseptic measures should be taken, and then the cord should be tied up with a clean and a sterile stump, and no application on the cord stump should be done. As in the rural areas, sometimes they put just cow dung on the stump of the cord, which can lead to tetanus neonatal. And the birth canal should also be kept clean by application of very safe practices, and harmful practices should be avoided. Now, hospitals and the health care centers should be properly equipped for the delivery, and midwifery kits are given to the midwives who want to conduct the deliveries at home. So the basic aim of a good intranatal care are: number one, thorough aseptic conditions should be there, and delivery should be done with minimum injury to the infant and the mother, and the personnel who was conducting the delivery and the team should be properly equipped to deal with the complications such as prolonged labor, or any antepartum hemorrhage or postpartum hemorrhage, or any convulsions or malpresentations, or the prolapse of cord. And when the baby is delivered, the care of the baby is at the time of delivery is very important. That the resuscitation should be properly done, and care of the cord should be taken, and care of the eyes of the baby should be taken properly, which we will discuss in detail in the next upcoming lectures. As I told you in the previous lecture, that sometimes the mother which have normal obstetrical history are usually advised, and also they feel comfortable by getting the delivery done at home. So the in such cases, the delivery can be conducted at home by the trained birth attendants or the midwives, which have a proper midwifery kits with them. So this type of delivery is called domiciliary midwifery services. You can get a OSPI question or a SEQ on domiciliary care. So this is an important topic. Now, there are certain advantages which are with the domiciliary midwifery services, and there are certain disadvantages as well. Now, the advantages of the domiciliary midwifery services are: number one, that the mother delivers at home in a familiar surroundings of her house, and this may tend to improve the fare associated with the delivery at in a hospital. And the mother is more comfortable and usually and is more happy to be confined in their own homes. Another advantage is that the chances of cross infections is less in homes as compared to the hospitals or in the nurseries. And number three is that the mother is able to keep an eye upon the children and other domestic affairs, and this may tend to ease her mental tension. So, these are the basic advantages which are seen with the domiciliary midwifery services, but it has certain disadvantages as well. Now, because of this, the mother may have less medical and nursing supervision as compared to the hospital, and another disadvantage is that the mother may have less rest as she wants to do certain chores of the children who are already there and gets involved in the domestic issues, so she gets less rest. Another disadvantage is this, that she may resume her domestic duties too soon and her diet may also be neglected. So, a domiciliary midwifery service has certain advantages as well as disadvantages. Now, next is that there are certain danger signals which occur during labor, and because of them, the need of immediate transferring of the mother to the nearest primary health care center or the hospital or the nearby facility is very important. Now, the danger signs are that if you feel sluggish pains during delivery, or if there are no pains, or if there is no progression of pains after rupture of membrane, then this is considered a danger sign, and the female should be rushed to the health facility as soon as possible. Another danger sign is good pains for an hour after the rupture of membranes, but the labor does not progress. Next is prolapse of the cord or hand or feet of the infant. Another is meconium stained liquor or slow, irregular, excessive, fast fetal heart rate is also another danger signal. Now, excessive show or bleeding during labor or collapse during labor is another danger signal, as if the mother collapses during labor, then she cannot push, so she should be rushed to the nearby facility as soon as possible. Another danger signal is that if the placenta is not separated within half an hour after delivery, or if there is any postpartum hemorrhage, and if the temperature occurs during delivery or during labor, and so these are all the danger signals and with which the mother is at danger, so she should be rushed to the nearby facility. So there should be a close liaison between the domiciliary and the institutional delivery services. Now, next, you should know about certain terms like, as we discussed in the previous slide about the domiciliary midwifery service, there is another term which is the institutional care. Now, institutional care is basically recommended for all the high risk cases in which the pregnant females cannot be delivered at home and the home conditions are not suitable, so they are usually taken to the hospitals or the nearby healthcare facilities in which they are delivered. And the mother is allowed to rest in bed on the first day after normal delivery, and on the next day she is allowed to be up and about and is discharged from the hospital. So this is about the institutional care. Another term is rooming in. Rooming in is a term which is used when you keep the baby's crib by the side of the mother's bed. This is called rooming in. Now, this arrangement gives an opportunity for the mother to take care of the child, and the baby is near her in a crib, and it's very easy for her to breastfeed the child and to take care of the baby. So you can get MCQs or small OSB questions on what are the domiciliary midwifery services, or what do you understand by the institutional care, and what do you understand by the rooming in. So next we'll do the postnatal care. Now the care of the mother and the newborn after delivery is called the postnatal or the postpartal care. So we will discuss in detail about the postnatal care in the upcoming slides. Now, postnatal care basically covers two areas. It is the care of the mother after delivery, which is basically the responsibility of the obstetrician, and the care of the newborn. Now, both the combined areas of responsibility are known as perinatology. Now, what are the objectives of postnatal care if we keep in mind about the care of the mother? Now, to take care of the mother, you should prevent the complications of the postpartum period. That's why we give postnatal care to the pregnant female. Now, another objective is to provide care for the rapid restoration of the mother to optimum health. Number three is to check the adequacy of breastfeeding, so that breastfeeding should be initiated as soon as the mother delivers the baby. And next is to provide family planning services and to provide the basic health education to the mother and the family about the mother and about the newborn. So these are the basic objectives of the postpartum care regarding the care of the mother. Now we will discuss in detail the objectives of giving postpartum care to the mother after delivering the baby. Now, number one objective, as I told you in the previous slide, was to prevent the complications of the postpartum period. Now, there are certain complications which can arise during the postpartum period, and they should be early recognized and dealt promptly. Now, one of these complications is the puerperal sepsis. Now, in puerperal sepsis, there is infection of the genital tract within 3 weeks after delivery. And this is usually accompanied by fever and high pulse rate, foul smelling discharge from the vagina, or pain and tenderness in the lower abdomen. Now, puerperal sepsis can be prevented by giving special attention during the delivery and after the delivery by providing aseptic conditions. So this is particularly important if the female is delivered at home or during the domiciliary midwifery services. Now, another complication which can occur during the postpartum period is thrombophlebitis. Now, thrombophlebitis is the infection of the veins of the legs, and it's frequently associated with the presence of varicose veins. Now, the leg may become tender, pale, and swollen, and this condition should also be dealt promptly. Now, another complication which can occur is the secondary hemorrhage or the postpartum hemorrhage. Now, bleeding from the vagina, which occurs after 6 hours after delivery till the end of the time of puerperium, that is 6 weeks after delivery, is called the secondary hemorrhage and may be due to the retained pieces of placenta or membranes. And these conditions can be dangerous, and it should be dealt accordingly. Another complication is that the female can get UTI or urinary tract infection, especially if she is and delivering the baby with C-section, as the females are catheterized because catheterized during the section, so they can develop UTI, or if the mother is not nursing the baby properly, is not breastfeeding properly, mastitis can occur. So these are the certain complications which can occur during the postpartum period, and they should be dealt accordingly, and prompt treatment should be given. The next objective of providing postnatal care is the restoration of mother to optimum health, so she comes out physically and emotionally from her experience of delivery. Now, this comes under three basic headings. Number one is the physical health. Now, physically, soon after delivery, postnatal checkups are very important. For the first 3 days, a daily checkup, which should be done at least twice daily, is very important. And then after that, once a day till the umbilical cord drops off. At each of the checkup, the doctor or the trained birth attendant or the LHP, whoever is doing the checkups, should see the progress of the normal involution of uterus, and a proper general physical examination should be done, that BP is checked, the pulse is checked, respiratory rate, any other abnormality, and examination of the breast is also important. And she should be asked if there is any signs of as bleeding, excessive bleeding, or any if there is any complaint of swollen leg, or any complaint of fever, or any sepsis is seen. So these all things should be dealt properly. Now, at the end of 6 week, an examination is necessary to check up the involution of uterus, which should be complete by the end of 6 weeks. Now, further visits should be done once a month till the first 6 months, and till the first year. After till the first year, then checkup should be done at every second or the third month. Next important thing which should be kept in mind is that some of the mothers usually are malnourished. So if you think that the mother is malnourished, she should be told how to take care of the nutrition, and her family should also be counseled about it. If the hemoglobin percentage is low, or if the mother is anemic, iron supplementation should also be continued for another year or so, according to the condition of the mother. And mother should also be told that she should do postnatal exercises, and gradual resumption of normal household duties can also bring her to the normal weight if she has not gained a lot of weight. Another important aspect is that psychologically and socially, the mothers are also at times very depressed, or they can be postpartum blues as well, and the mothers can go into depression. So these conditions should also be dealt accordingly, and the mothers and the family should be counseled about them. So this is all about the intranatal care and the postnatal care. If you have any questions regarding these two topics, you are most welcome to ask. Thank you.